Yeah, hello everyone. My name is Toyosi Labeodo. I'm the principal immigration consultant of TrueLink Immigration Services. So I'm here today to talk more about healthcare services. But before I go on, I want to encourage you to follow us on all our social media channels. Follow us on Instagram, Twitter, LinkedIn, Facebook, and don't forget to also subscribe to our YouTube channel. Our handle is TrueLink Travel. So that when we post any video, you'll be the first to get to know about it and watch our videos. Now, going to what I want to talk about, that is healthcare. Many of us don't know what we have when you talk about good health. When we have a little health challenge and you have to visit the hospital and you are told to buy some things, you're paying for admission, you are buying drugs, that is when you actually value a lot of things that we benefit here. As I said in one of my previous videos, healthcare in Canada is free. So for those of us that have lost a loved one, or that have lost a loved one because of inadequate or poor quality health services in the country where you live, or for those that have experienced health care in those countries, maybe you have a loved one who was in the hospital and you know what you went through, you know how much you paid, you know how much you spent. I think you will actually understand what I'm talking about. I'm not very well. My dad had an accident some years back and he was hospitalized. He had a fracture, and I can tell you that a consultant in one of the big hospitals in Nigeria operated on him twice for the same hand. He had a fracture of the humerus, and 2 times he operated that hand, and still my dad had a simple fracture. Let me tell you, simple fracture. Let me just put it like that. Let's talk like that. Let's leave it like that. And he was going to do the 3rd operation, and I said no, you will not do a 3rd operation for the same thing. What is the problem? Why are you not getting it? A professor, a consultant who has been doing his work for so many years. I don't know what went wrong, but finally we got him to come. We took him overseas, and the surgery was done. Up to today, he's fine. And I remember one of the things the doctor asked them was, why did you allow, I thought you were learned, why did you allow them to put this thing in your hand? That's what they asked him. So it was like, what they put in his hands was not the right tools, the right materials and all that, and so many other things. So what am I trying to say is, when you have an health challenge, when the service is free, and you are sure that the quality of the service you are getting is high quality, that is something that people should cherish. So when we talk about free healthcare services in Canada or thereabouts, it's something that people are looking out for. Yeah, that's one reason why some people want to migrate. Yeah, that is one major reason, because they are sure that if there's anything, if you have any health issue, they can easily diagnose it. They have the right tools, they have modern tools. If you are even hospitalized, you are sure that you are getting the best of care. You're not bothered that, are they trying to use you to do trial and error? Are they trying to diagnose you and they don't even know what they are doing? You don't get that kind of thing. Doesn't happen here at all. Over here, you get quality service for what you are doing. You get quality healthcare services, and you don't have to pay for it. It's free. It's free. So it's not like you have to pay, or you have to know somebody who is going to refer you somewhere, who would have to link you to the big boss there, who would direct his boys to help you in the clinic or no. All you just need to do is go to the hospital, make your complaint, and they will attend to you. So when you have health care, you have wealth, and that's why some people say health is wealth. That statement is really, it's true. It's really correct, because when you are not healthy, if you fall ill and you have to be hospitalized where you are, and maybe you have to be there for some days or months, you spend a lot. And if at the end of the day you are misdiagnosed, or maybe you are not given the right treatment, it could lead to other issues. So healthcare is one major reason why some people want to migrate to Canada. And I can tell you that the healthcare service here is free. No matter your health condition, no matter how bad it is, healthcare is free. They will treat you free of charge. If you have to do surgery, it's free. All the materials you buy is free. You won't be told, they won't tell you go and buy this from this pharmacy. If you have not brought it, they will not treat you. No. Even when you come, they will treat you for. They won't start asking you, oh, go and bring this money. Go and, no. They will treat you first. You know, because one, it's free, it's covered. So when you are done, the government pays for all that, all your bills, and you are good to go. But in many other countries, it's the reverse of the case. They first tell you, oh, go and deposit this amount for us. You run up and down. If you don't have it, it becomes an issue. If you have it, fine. But if it's prolonged or extended, or the thing you want to, the health challenge is a big one, wow, that might take a large chunk of your funds. And at the end of the day, if you are lucky, you still get quality services, fine. But most times, do you really get that quality service where you are? In Canada, the healthcare service is superb. Quality service for everyone. So don't forget, once again, to subscribe to our YouTube channel. Our handle is @Thrilling Travel. Also follow us on all our social media channels: Facebook, Twitter, Instagram, and LinkedIn. Our handle again is @Thrilling Travel. See you guys.